Ever wondered what makes cancer one of the most dreaded diseases in the world today? At its core, cancer is just uncontrolled cell growth. Cells usually divide and grow in a controlled way, but sometimes they start to grow out of control. This can lead to a mass of extra cells, which we often call a tumor. These rogue cells can affect various body systems and can strike at any age. Cancer is an intricate disease with over 100 different types known to us. Cancer isn't just one disease. It's a collection of many diseases, each characterized by the uncontrollable growth of cells. The most common types include lung cancer, often linked to smoking and air pollution; breast cancer, one of the most common in women worldwide; colon cancer, which tends to affect both men and women as they age; and skin cancer, with melanoma being the most dangerous. But remember, there are many more. Each type of cancer is unique with its own causes, symptoms, and methods of treatment. Are we all at risk of developing cancer? Well, certain risk factors do increase the likelihood. Age, for one, as cancer is more common in older individuals. Lifestyle choices like poor diet, lack of physical activity, and tobacco use also contribute. Even genetics play a part in some cancers. But here's the good news. Prevention is possible. Regular health screenings can catch issues early. Maintaining a healthy lifestyle and steering clear of tobacco can drastically reduce risk. While we cannot control all risk factors, we can certainly make choices to reduce our risk. How can we know if we have cancer? A question that's often asked, and rightly so. Cancer can present with various symptoms, such as unexplained weight loss, persistent fatigue, or changes in skin. Sometimes it's a lump or a nagging cough that just won't go away. Yet, keep in mind, these symptoms could also indicate other health issues. That's why regular screenings are vital. They can help catch cancer early when it's most treatable. Remember, early detection is key in the fight against cancer. Once detected, how do doctors determine the extent of cancer? It kicks off with a diagnosis, usually involving a biopsy to examine the cells, and imaging tests like CT scans or MRIs to visualize the cancer's location. Then comes staging. This is essentially the cancer's report card. It tells us the size, location, and if it is spread to other parts of the body. This information is vital as it guides the treatment plan. Remember, accurate diagnosis and staging are crucial for effective treatment planning. How do we fight back against cancer? The answer lies in a plethora of treatment options available today. It's akin to having an armory of weapons at our disposal, each designed to combat this pervasive disease in its unique way. Let's start with surgery, the oldest form of cancer treatment. It's often the first line of defense, especially when the cancer is localized. Then there's radiation therapy, which uses high-energy particles or waves to destroy or damage cancer cells. Chemotherapy, on the other hand, is a systemic treatment. It involves using drugs that can kill cancer cells throughout the body. Immunotherapy is a newer approach that boosts the immune system to fight cancer cells more effectively. In addition, targeted therapies are designed to attack specific weaknesses in cancer cells, while hormone therapies block or lower the amount of hormones in the body to stop or slow down the growth of cancer. The choice of treatment, however, depends on the type and stage of cancer, among other factors. Remember, cancer treatment is often a combination of therapies, tailored to the patient's individual needs. Cancer is a journey that no one should walk alone. Emotional support plays a crucial role in the fight against this disease. It's essential to have a solid network of friends, family, and healthcare professionals. There's an abundance of resources available. Support groups, counseling services, and informational websites provide invaluable assistance. Financial aid programs can help manage treatment costs. And let's not forget the power of self-care. Meditation, exercise, and proper nutrition can all aid in the healing process. Support and resources can greatly improve the quality of life for those affected by cancer. Are there people who have beaten cancer? Absolutely. And their stories are sources of inspiration and hope. Take, for instance, Jane, a two-time breast cancer survivor who now advocates for early detection, or Tom, who battled lung cancer and now runs marathons to raise awareness. Then there's Sophia, who overcame childhood leukemia and now works as a pediatric oncologist. These stories of hope remind us that cancer can be beaten. What are some common misconceptions about cancer? Now, let's debunk a few. First off, Cancer isn't a death sentence. With early detection and proper treatment, many types can be managed or even cured. Secondly, cancer isn't contagious. You can't catch it like a cold. Lastly, it's a myth that sugar feeds cancer. While a healthy diet is important, sugar doesn't directly fuel cancer growth. Armed with the right information, we can make better decisions about our health.